Wednesday host for FTRealM. I hope everyone's having a good week. I'm having a good week. It's freaking hot, and I'm super excited to have the sunshine, but just not right now because I haven't put the air conditioner in my house, and my hair's being crazy in this hat, and so I'm going to play with it for a second, apparently. But with the sun coming out, and I've noticed that I've been running in and out of my house a lot without my shirt on to, like, take out the trash and stuff like that, I wanted to do my topic choice on taking care of your scars within the first 2 years, kind of what I plan on doing for my second year, being coming up to my 1 year post-op mark, which is on June 26th, and what I did last summer when I did go outside a couple of times shirtless, because who doesn't want to run around shirtless? I mean, I want to run around shirtless if I can. And so last summer, I was really hesitant to even take off my shirt. And it was because of your scars can get sunburned really easily because it's new skin, and so it's not as tough as the rest of our skin on our body that we've had for quite some time. And so it's recommended that the first 2 years you take extra good care of your scars, and even past that. But it's really critical or crucial within the first 2 years because that skin is not used to being exposed to the sun rays, not used to, it's a lot thinner, I guess is what I'm really trying to get at there. And so it's just easily scarred on top of a scar. And so if you get a sunburn on your scars within the first 2 years, what could happen doesn't necessarily mean it's going to happen, but what could happen, and what, especially within the first year, it's more likely to happen, is this is more likely to stay a red color, like a sunburn color, or like a bright pink color. And so people are going to notice your scars more. There's a high chance that that's going to happen. So in order to minimize that, we want to take some precautions. And so last summer, I didn't want to take my shirt off. Like, I was freaking out about taking my shirt off. And my friends are like, no, it's totally cool. Like, you can do it. And I'm like, I know I can do it, but I don't want to get a sunburn. Like, I'm freaking out here. So if there's no sunblock available, I'm not taking my freaking shirt off. And so that was my rule. If there was no sunblock available, I was not taking my shirt off. No way, no how, unless the sun was down and it was dark out. So that way I couldn't get a sunburn. Now, when I did go tubing a couple of times last year, and I was out in the sun during the day, I even thought about not taking my shirt off then. But I wanted to do it because I was like, hell yeah, I can be outside without my shirt on, and all the other guys are going to be outside without their shirt on, and I want to blend in with them, so fuck it. And so what I ended up doing was just using a spray SPF because it was really sore in this area the first 3 months or so. 3 to 4 months it was really sore, and I didn't really want to do a whole lot of rubbing because it was still healing. And so a spray sunblock is really good for that. You want to shoot for at least 40, if not higher if you can. I think the sunblock that I used was SPF 40, because that was just what everyone had, and then I kept it with me because I was highly concerned about making sure to reapply it every so often. And so if I thought that I had gone a while without spraying it on, I didn't time it or anything like that, but I would recommend every 2 hours to spray it on for the newly chested men out there to help minimize getting a sunburn in that area. And you want to be just I was like hyper cautious, like I was freaking out, so I was like crazy with it, okay? It's okay to go crazy within the first 2 years. And then after that, another thing that I did use was vitamin E oil. I probably did this about 3 months or so, twice, 5 minutes on each side every other day, and that really reduced it. The redness did go down quite a bit within probably 3 months or so that I did it, and then once the redness kind of started looking like it does now, which is pretty minimal, I don't know what that is. That's the sun doing something cool. But this is what it looks like now. Looks pretty good, I would say. People are if I'm just walking around, nobody really notices that I have scars unless, like, you're up close in my face kind of thing. But everyone that's that close to me is typically my friends, and they know me, and so it's completely fine if they see my scars. And my pec muscles, you can't really notice from this angle, but my pec muscles do shadow these scars here, so the only one that really people are going to see is this one because it goes higher up in my armpit because this side was bigger. But my plan for this year, being 1 year post-op, working on my second year, being post-op, is to maintain keeping sunblock on my chest, especially my scar area. And if you're using Mederma still or within any time, spraying on is really good. I have a preference to use spray on just because I go hiking, and it's just easier to put sunblock on my back and on my chest, single-handedly kind of thing. But I'm going to go ahead and cut the video off here. So if you have any questions, concerns, you want to talk to me about maybe my surgeon or anything like that, you can check out my personal channel. I'm going to do an update on it anyway, or you can just ask me here, and I'll answer them for you.